When administering insulin, there's a couple things to review. One, there's different units and syringes that apply for each insulin. So this one is U100 and this syringe is U100. And then this bottle of insulin is U40. And this syringe says U40. When you're administering insulin, you want to make sure that you roll the bottle and warm up the particles so it evenly disperses. This insulin has a little sediment on the bottom, which needs to be mixed into the rest of the solution. So I would roll it between my hands for about 30 seconds so it's a little bit warmer, and make sure it then becomes a cloudy solution, because that's what this insulin is supposed to look like. I don't want to shake the bottle to disperse the particles unevenly. That might just take a little bit longer. You can see it's starting to dissolve. Okay, it's now 100% dissolved into the solution. So this insulin would be safe to use. This is insulin for the U140. This is a different type of insulin called NPH or hemoglobin N that has used the U100 units and measurement. And this does not have to be mixed up the same way that that does. It won't have a sediment on the bottom. So I would just roll this between my hands and let the particles just disperse a little bit more evenly. And this would be okay to give. For the insulin syringes, each dash is 1 unit. So for example, this would be 10 units, and this would be 11, 12, 13, 14, and 15. To use a syringe, you would pull the cap off, expose the plunger, pull back the plunger, make sure it's just loosened up. You would pull off the cap, expose the needle, and then you can puncture the bottle. You want to invert it so that the fluid goes to the bottom. And then you would pull back the plunger, we'll say to 4 units. And make sure there's no little air bubbles. You can just tap the syringe. The air bubble would float to the top. If there was an air bubble, you would just push it back into the bottle, and then what's left would be your insulin. So this would be 4 units of insulin. And recap it, and it's okay to give to your pet. I'm going to show you how to wrap your cat. So that way if you have to give an injection of any sort and they're a little wiggly, it makes it a little bit easier. So I like to wrap from above. You take one part of the towel and wrap it in front of their legs and their chest. You take the other part of the towel and do the same thing. And then you can hold them against your body with one hand as well as the other hand. And once they feel snug, you can pull back the towel to where you want to give the injection. If you have like a wet washcloth at home, it might be easier to dampen the skin. That way you can kind of see where the fur parts, and you can see the skin a little bit easier. That's like the skin right there. And then if I was giving the injection, I would pull off the cap I would tent the skin and feel for the hollow area in between the two layers of skin right here. I would push the needle in all the way so you can only see the syringe, not the needle. I will pull back, make sure there's no blood or anything in the hub, and then give the injection. Okay, if we're giving insulin to a dog, I would have them sit. And then she likes to lay down. I would, once again, part the fur. Uncap the needle. And tent the skin. And feel for the hollow area beneath the skin. And put the whole needle into the skin so you can just see the syringe. Pull back, make sure there's no blood, and then push the solution through. And then recap the needle.